I'd think I've had enough time looking after myself, let alone a baby. I think things that I didn't want to tell anyone. I worried that if I did, they'd take him away. On my own, my thoughts just got darker and darker.
I had this idea of what a mum should be, but felt I couldn't keep up. Eventually, I was so tired, I just felt grey, like half alive. But I couldn't take a break or let her out of my sight, even for a few minutes.
I was terrified to be left alone with the baby. She'd wake up and I'd be paralysed with fear. Every time my wife got up to deal with her, I just felt worse. There was lots of guilt, but I didn't talk to my wife about it because I didn't want to make things worse for her. It was a vicious cycle.
I didn't realize how out of control I felt. I was sure that if they knew about it, they would take my baby. My partner was worried, contacted NHS Direct. Very quickly, someone called me back, reassured me, and worked hard to help us find a way forward as a family.
Many parents experience anxiety, depression, or some other form of mental health difficulty in the first few months or years of a child's life. For those with a history of mental health problems, or without adequate support, it is even more common. Many parents suffer in silence, or wait until the situation becomes critical before asking for help. In Greater Manchester, we want to help new and expectant families get off to the best possible start. So whatever's going on for you, no one's issues are too mild or too complicated to make use of the wide range of services we have to offer. And if you need to, you can dip in and out at any time.
I broke down in my GP's office and she made a referral. I did my first sessions with the perinatal specialist online. She understood what I was thinking and feeling, and she explained that it wasn't unusual. Mental health problems can happen to anyone. And she offered reassurance that it was very common, and it gave me hope. I'm not going to sugarcoat it. It was a long road for me, but as soon as I got help, things started to feel better.
The group was judgment-free. Hearing their stories made me realize that while I might not be perfect, I'm doing my best, with love. He does not cry because I'm not the mum he imagined. There are lots of reasons why he might be crying. I see now that my experience helps new people too. I was not expecting that, or to make friends, or that we would spend so much time just laughing together.
With the other dads, I spoke honestly, without worrying I might make things worse. Being supported wasn't selfish. It meant I could support my family better, be the dad I wanted to be, and really enjoy spending time with my daughter.
All the support made me feel safe. Looking back, I'm so glad we were brave enough to take the first step and ask for help.
If you or your partner need a little bit or a lot of support, speak to your GP, midwife, or health visitor about getting a referral. Or if you'd just like to find out more on your own, visit tinyurl.com/GMPIMH and follow the links to someone that can help. We also have 24-hour free phone helplines available. Alternatively, if at any time you or your partner don't feel safe and need some immediate support, you can always go to A&E or call 999.